morning. Today we're working with Alex here. He's training to be a professional boxer. So he's having some issues with his left knee, and so we're going to do a little evaluation. We actually did our evaluation already. We're going to do a little overview of our treatment protocol on him. We already assessed. There's no major. He's got normal muscle strength, normal deep tendon reflex. We did some orthopedic tests on it. It's pretty normal. We're just going to kind of check it out and see what kind of range of motion issues we got going on, any adhesions or dysfunctions we got going on to his knee. So go ahead and lay on your back for me. And since it's the knee is part of the kinetic chain, which involves the low back, we have our hip, and then our ankle, foot. And so we've already assessed his hip. We'll go over some of the stretches that we've done to his hip already. We'll assess the knee, then we'll assess his ankle, because everything moves together for proprioception when he's doing his different training and then his actual sparring competitions. So we'll check his hip range of motion here first. Check his performance. Check his glutes. Check the last tendon. Check his psoas major. Straighten your leg. And back up. And down. And back up. And one more. And back up. Check the iliacus. We've already adjusted his low back to level out his pelvis. Make sure there's no dysfunctions going on in there. Check the adductor. Check his fibular head. Check his talus. Check his navicular. Cuboid. Calcaneus. We'll check the knee range of motion here. So we've already assessed him doing several orthopedic exams and stuff to rule out any tears or anything. Just trying to check in the range of motion, see if we have any fixations going on. A little bit of tibial rotation in here. And so we'll go ahead and take that out using our little extremity boards now. So his tibia and femur are a little rotated, so we want to kind of take that rotation out and level it out. Moving better. Good range of motion. We have to assess the adductor portion. Drop your leg here. So we will check the quads and everything. So now what we're going to check is his adductor muscles, which insert over here in the lateral aspect of his knee. We'll do a little pin and stretch. So we'll go ahead and pin that adductor, straighten your leg, and down, and up, and down. Up, and down, one more, up, and down. Go ahead and so, I'll do it again, straighten your leg, and down, straighten your leg, and down, straighten your leg, and down. Excellent. I'm going to check his tibialis muscle here, pinning and stretching. Face down for me. So we want to go ahead and address all the muscles and structures that start here and here and come down and attach onto the knee. So now we're going to hit the posterior calf aspect. We get our gastrocnemius heads, and then we got our soleus. A couple of the extra other muscles we get going down here. Pinning and stretching some of these, loosen them up. Twist his hand straight. And this side fine. So we're going to adjust some of the muscles over here a little bit. We have your IT band. This is actually a tiny little muscle up here. It's about this big, called your tensor fascia lata. And then the muscle's tiny up here, but then you got this giant band along the outside of his leg called your iliotibial band. Comes down here and attaches on the lateral aspect of the knee. So this one, we'll pin it. I'm going to straighten your leg. Bring it back, back, and down just a little bit, and back, and back, over, and over, down here, twist it here. We'll just check these glutes again real quick. So we're going to pin, and then go bring that knee up, up, and down, up, and then up. Up and down. On your back. I'm going to assess some patellar motion here. Because normally your patella sits right in the center there and then glides nicely. So I want to make sure there's no restriction in there. You can see on Alex, it's another side condition you can see in a lot of women is a lot of women runners and basketball players and stuff like that, is they get a lot of knee injuries is because of biomechanics. So a lot of it is they get a lot of a tight IT band over here. And so the vastus medialis obliquus, this muscle right here, straighten your leg, this big guy right here, is nice and strong. And a lot of it is genetics. So genetically men have big ones. Big vastus medialis obliquus, just like me, I got a big one here too. And so a lot of the times women have smaller or weaker VMOs, and so what happens is this isn't as strong to stabilize the patella over here. And so what happens is this patella, because the IT band gets tight when we do activities and a lot of times jumping and stuff, and it starts to slide itself over because this will pull it over. And what happens is you get one of these because this is weak. And the way we land, it causes a lot of shear force, and that's why you can get a lot of ACL injuries. A lot more women get that, girls, women. And so what we want to do is, if you look at a lot of the literature, it says that this is a giant tendon. You really can't, you can foam roll it all you want, but you can't change the tensile strength in it, your IT band. So you want to do is strengthen the other structures around it and stabilize it by strengthening the VMO to kind of even out that stress to help keep that your patella straight, to avoid that. It's called lateral patellar tracking, which can lead to stuff like patellofemoral pain syndrome, or in young individuals, you got tibial tendonitis, or in the really young, Osgood-Schlatter's disease, which is that irritation down here at the tibial plateau. But let's go ahead and assess some of the structures here. We just addressed the joints, we addressed the muscular aspect. Now we're going to go ahead and address the soft tissue aspect of it, the fascia. Let's get this stuff up. Now we're going to get a little lube going on. Avoid friction. Just going to go over a couple of these structures, address, see what we got going on. You train every day? So Octa trains every day, so he gets a lot of repetitive stress issues because you're constantly doing a lot of the same motions, twisting and bending and stress on the structures. We'll kind of just do an overview, breaking up some of these adhesions. You can do it manually. Today we're going to use a little bit of instrument assisted, using these instrument assisted soft tissue technique tools. The stainless steel instrument is specifically designed for different shapes of the body and for the practitioner to ease stress on me as well. What I'm going to do is a couple overview here. Check his quads first. If I push too hard, just let me know. Get her in there. What we're doing is a couple diagnostic passes to look for any adhesions, scar tissue, fibrous adhesions in the tissue. To go and break those adhesions up so that and to increase blood flow to help prevent any further injury and to help allow the healing process properly. So we'll just go in a couple directions. So check out our fascia here. Check our lateral joint line here. Which is always a nice tender spot. And as again I've pointed out in the other videos, the object isn't to go in there and just break up as much blood vessels and get this nice and red and bleeding like crazy and have it bruise up. That's not the point of it. We want to break up the scar tissue, yes. We want to increase the blood flow, stimulate the laydown of proper tissue collagen. But you don't want to damage the tissue too much because the body can only heal itself so fast. It's called the limitations of matter. And so you can actually do more damage. It's kind of like lifting biceps heavy every single day. You'll actually tear down more tissue than your body can repair itself, which will be counterproductive. So we'll check the medial joint line over here. You all right?
Mm-hmm.
This is kind of a secondary complaint on Alex. Mostly it's his shoulders, his lats, because he's doing a lot of twisting and throwing punches and rotation. We've already addressed that today. Just taking a little peek at this knee issue today. Then in our examination, we realized he's got a lot of tension in the anterior aspect of his patella. So we did everything passively. Now we're gonna have him do a little active movement to help break that up while he's moving it. So go ahead and straighten your leg nice and slow, and bring it back up. And nice and down, nice and slow. And we'll bring that back up. Excellent. Go ahead. Now we're gonna do a little resistance. Go ahead. Push down again. I'm just gonna resist you a little bit. Back up. Let this slide off. And go ahead and push forward. And down. Up. And down. And up. And down. One more. And down. And as always, one of my main treatment philosophies, I don't believe that one aspect is key into working on a patient. I don't think it's just decompression, only adjustments, only working on the muscles, only doing instrument-assisted soft tissue mobilization. I believe it's the whole concept is to hit kind of the whole kinetic chain, address the bone joint issue, address the muscular issue, and then check the fascial system and then kind of go from there. You do it passively, we do it actively, and then we'll do it resisted if we want to. Say Alex was having issues in a certain aspect when he was doing squatting with this knee issue. We'd have him squat, and then we would assess his knee issue while he was squatting, different aspects like that. All right, thanks for joining us today.